Hi, my name is Lisa Martinez, and today I'm here to talk to you about genital herpes. A little bit about my background is I've been an LPN since 2005, and recently, last January, I started the LPN to BSN program. Some of my nursing background is kind of wide range. I've done some long-term care, physician's office, the prison setting, community health nursing, the behavioral unit, an anesthesia technician, and currently the post-surgical unit. um, my reason for educating on genital herpes is I wanted to inform others of how the transmission occurs, symptoms, diagnosis, and treatment. And also my greatest focus on this would probably be the stigma and shame placed upon people who have genital herpes. It's been like this for years and years. It seems like it's usually the younger population, but even adults joke about it if it's brought up, and it can be really detrimental to someone's self-esteem. There are two types of the virus. Um, there's the HSV1 and 2. One is generally linked to more of the cold sores, the virus, and two is generally linked to the sexual intercourse. Um, the cold sores, you know, the part one can be responsible for genital herpes as well, but normally it's two. Um, HSV1 is commonly transmitted via contact with the virus in the sores around the mouth and the saliva. HSV2 is mainly sexual intercourse, the genital or anal area, or oral sex. Both viruses can be shed from normal appearing genital mucosa, which stems a problem because a lot of times when people transmit the virus from one to the other, they're sometimes not even aware that they have it because there's no, evidence, there's no source. Most individuals infected with HSV are asymptomatic or have mild symptoms that are mistaken for other skin conditions, rashes, and sometimes even misdiagnosed. The appearance of a herpes lesion typically appears, they're described as vesicles or blisters around the genital area, rectum, or mouth area. The incubation period can be 2 to 12 days after exposure. The vesicle they rupture and leave painful ulcers that may take weeks to heal after the infection. This is known as the first, what they call the outbreak, which is generally way more painful and a longer duration. Manifestations of genital herpes differ between the first and the reoccurrent outbreaks. Typically, the reoccurrent outbreaks are shorter in duration and less painful, less symptoms, more manageable. Here's an illustration of like a cluster of lesions. And here's another illustration, a closer up, how they look blister-like. They look extremely painful. And, that has to do with nerve endings. And from what patients have reported to me, it is extremely painful. Some of the symptoms described are fever, body aches, swollen lymph nodes, headache, tingling pain in the genital area, legs, hips, or buttocks, genital ulcers. I've had it described to me like it's like extreme flu-like symptoms, just aching and chills, and if you wouldn't have the ulcer present, you would think that you had the flu. That's how patients describe they feel during the initial outbreak. Sometimes there can be rare complications with the genital herpes virus that people have had aseptic meningitis, which is inflammation in the linings of the brain, or meninoencephalitis when the meninges and the brain have an infection. Neonatal herpes passed from the mom. Herpes lesions increase the chance to acquire the HIV infection. The diagnosis and treatment of genital herpes, it's usually diagnosed per viral culture or exam. There is also a test, a PCR and an AAT. From what I've seen, the few cases, generally it can be really visually diagnosed if there's ulcers present. There is no cure for genital herpes. It's a lifelong infection. Antiviral medications help to prevent and shorten the outbreaks. Some of the common antivirals are cyclovir, is what you see most, and there's famciclovir and valacyclovir. There is currently no vaccine for genital herpes, although there are vaccines in clinical trials. And I do believe within 5 years there probably will be a vaccine, which is great for the younger generation. Constant use of latex condoms greatly reduces the chance of acquiring genital herpes. And of course, if someone does have an outbreak, you avoid sexual intercourse during that time. There's other considerations. It's a viral infection that's lifelong, incurable, and you can have to deal with recurrent outbreaks. The development of vaccines against HSV would have a huge impact, globally on people's sexual and reproductive health. And it also would have a huge impact on the stigma and shame due to the infection. It can be huge psychological distress on people, and it contributes to its spread because you defer disclosure to your sexual partners. This can lead to low self-esteem, isolation, depression, fear, and rejection of partners. And here's another illustration of more of an ulcer, the white. Higher public awareness of the HPV infection, increases stigma and feelings of shame upon testing positive. This could possibly decrease in the future if this was ever presented more as normalization, a more common term, a more normal situation that people have to deal with instead of the shame. Even with suppressive antiviral treatment, it can fail to lower someone's fear to tell their partner the truth. Typically, the chances are greater to be honest if it is a serious relationship rather than a casual. But often, even, being in a serious relationship, people aren't honest. And typically, if you're on a daily suppressive antiviral, the outbreaks are very, very minimum. But still, you always have to, you always have that chance that you could possibly transmit it to your partner. And even being on a daily antiviral suppressive therapy, you need to always, always, always use a condom. Higher public awareness and normalization are very important to make it comfortable for partner disclosure. And it can be, economic burden for some people and populations. Not all people have access to health insurance. Not all people have the financial means, the transportation, the medical care. So sometimes that plays a part in transmission, such as, prostitution. Lifelong cost of the medication can get expensive. The price has came down the last several years. I'd say within the last 10 years, it's a great difference. And sometimes facilities often require lots of routine and follow-up visits that people can't afford. Treating HIV can worsen the clinical course of genital herpes. Many individuals with genital herpes struggle with herpes-related spending on treatment, wage loss due to being absent, and just reductions in your quality of life overall. Current therapy includes episodic antiviral treatment to reduce the time of healing and the daily exposure of antiviral therapy. Hopefully, in the near future, there will be a therapeutic vaccine to reduce clinical reoccurrences. Self-care during an outbreak, is more like comfort care, Tylenol, cold compresses to relieve pain and itching. Society portrays people with genital herpes as dirty and promiscuous. People who have the virus can lead normal lives and usually does not have any long-term ill health effects. Couples deal successfully with herpes using suppressive antiviral therapy and condoms. The stigma can damage sexual intimacy, confidence, and your self-esteem. Stigma and shame cause struggle to be honest. This creates a ripple effect that contributes to the prevalence of the condition. Many people fear that the virus, they fear it because of the lack of education and transmission. It's just something people joke about. It can remain dormant for months and years, allowing the infected to pretty much live a normal life. Thank you.